Welcome back to The Link. We're back at Coweta Samaritan Clinic with Executive Director Lou Graner. Lou, we were talking with Dr. Crosby, with Peggy Lawson about great volunteer base that you've got here, about great relationships that you've established to help patients do things like get the medications that they need. We're in the dispensary. Talk about the PAP program.
Well, it is a phenomenal program, Mark. Laura Thomas, who works here at the clinic, has compiled a group of volunteers that are working with the patients. I think Peggy and Kay mentioned it's a very onerous process, but these branded prescription medications are very expensive, and probably the application process would be a deterrent to the patients were it not for a little help from Laura and her team of volunteers. Already in 2013, we've had about 300,000 of retail value of prescription medications coming into the clinic. We have about 150 patients who are receiving one or more branded prescription medications for free from the drug assistance programs. I know Peggy mentioned diabetes. We don't have one insulin-dependent diabetic who's paying for their insulin. So it's a phenomenal program the drug companies have, but it's the great work of Laura and the team here to be helping the patients, because the chronic folks, the medications are a critical portion or a component of their long-term care.
Right. So those patients are taking the direction of Dr. Crosby in part because Peggy, Laura, others have put together this ability for them to get their meds. Nothing narcotic here, but many, many things that they can get, and you've got those relationships with the pharmaceutical companies.
Indeed, and it is important to note we don't have any narcotics. We don't prescribe or dispense narcotics. But one of the things we're excited about as we wrap up, really getting close to our second year here in October, is how we're broadening the scope of our services. We have 2 volunteer nutritionists who come to the clinic, one on Wednesday, one on Thursdays, to help patients who have dietary questions, to help them learn how they can eat in a more healthy but economically affordable way. We have a pastoral counselor who comes and is here on Wednesdays to see patients. I think Kay and Peggy probably mentioned that depression is one of the bigger diagnoses we see. We have a volunteer who's putting together a patient education program for us. The Area Agency on Aging is leading a chronic disease management class for interested patients. There's a group of about 8 that have been part of a 6-week class that concludes next Thursday night for this first go-round. And then I'd like to mention the YMCA, because Shane Gann and the folks over at the Y have made free memberships available to patients who are referred to them by the doctors here. And so, again, we're really trying to help patients, because most all of our patients have chronic diseases. We're trying to help them deal not only with the direct patient care, the medication, but the lifestyle changes and the psychological issues that they struggle with.
So you guys at Coweta Samaritan Clinic have not stopped with the notion of just providing services today. You're looking to the future. You're looking at patients holistically. What's on the horizon?
Well, one of the tremendous needs that's out there, and many of our other free clinics that we're familiar with have encountered, is dental. A lot of patients come with painful abscesses. They often haven't been seen by dentists for many years, and we're working with some of the dentists in the community. They have been really great about expressing interest and willingness to see our patients, and we're looking at securing a location. We're pretty confident we're going to have a location for the fall where volunteer dentists in the community will go to that location and see Samaritan Clinic patients to help them with extractions and other pain management issues.
Lou, when this started, as we wrap up thinking about it, when this vision, Dr. Crosby and others started several years ago, none of this was really foreseen, though it was desirable. How'd you put it all together in 30 seconds? How did you make all of this happen so quickly?
Well, I didn't. We didn't. The community did. It really is, Mark. We like to say the Coweta Samaritan Clinic is the citizens of Coweta County caring for their neighbors. Virtually everything that's done here is done by volunteers. We're funded entirely with private donations. It is literally the citizens of this county stepping forward and taking care of their medically underserved neighbors. And can't say enough about what they all do, and I just hope the community will continue to embrace this because it's the community that's making it happen.
It's the community that's making it happen. What a great way to end this segment with Lou Graner, Executive Director, Coweta Samaritan Clinic. Thanks for being with us today.
Thanks for having us.
You stay tuned. The link will return.